Hello, my name is Gabriela Luzuriaga Maldonado, and now I'm going to talk about gastrointestinal complication of granulomatosis with polyangiitis. About definition, it is a type of vasculitis or inflammation of the blood vessels. Inflammation limits blood flow to important organs and causes damage. It can affect any organ, but mainly affect the sinuses, nose, trachea, lungs, and kidneys.
Hi, my name is Dr. Les Mertz, and I'm a rheumatologist at the Mayo Clinic in Arizona. I would like to tell you about an autoimmune disorder called ANCA-positive vasculitis and a new study that the Mayo Clinic is participating in at this time. Most of you already know something about the immune system. When the immune system functions normally, it helps to fight off viruses, bacteria, and cancer cells. When the immune system functions abnormally, you may develop unusual infections, or damage to the normal cells and tissues of your body. Autoimmune disorders develop in such circumstances, and you already likely know about some of them, including rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, scleroderma, and vasculitis. One of the most common types of vasculitis is ANCA-positive vasculitis. ANCA stands for anti-neutrophil cytoplasmic antibody and represents the antibody that can be found in your blood when you have one of these conditions. There are actually three of these, including granulomatosis with polyangiitis, previously called Wegener's granulomatosis, microscopic polyangiitis, and eosinophilic granulomatosis and polyangiitis, previously called Churg-Strauss granulomatosis. If you have granulomatosis with polyangiitis or microscopic polyangiitis, your doctor will likely prescribe medications that suppress the immune system to reduce the inflammatory damage that may occur to your tissues and organs. These medications may suppress the immune system enough that you will actually develop an infection or be at increased risk of developing a cancer. In April of 2001, the FDA approved a new treatment for granulomatosis with polyangiitis and microscopic polyangiitis. Since it is a relatively new treatment, the pharmaceutical company is sponsoring a study to help determine even further the benefits and side effects of this new treatment being used for treating patients with ANCA-positive vasculitis. Our three Mayo Clinic campuses in Arizona, Florida, and Rochester are participating in these studies, and you might be a candidate to participate in them if you have granulomatosis with polyangiitis or microscopic polyangiitis. You may review the details of this study on the internet at clinicaltrials.gov by searching ANCA and observational studies, or by typing in the identifier number, which is NCT 016-13599. In this study, you will be treated according to your doctor's best strategy. A 4-year follow-up period of time is planned to record benefits and side effects that occur of this new therapy. Thank you.
About applications in medicine, the cause of this disease is unknown. It can affect people of any age. Men and women suffer it equally. It is more common in Caucasians. Symptoms can include joint pain, weakness, tiredness, and flu-like symptoms such as a runny nose that doesn't improve. Doctors use blood tests, chest x-rays, and biopsies to diagnose the disease and rule out other causes based on symptoms.
All right, our scene on Wegener granulomatosis is going to be represented by this vegetable beggar over here. Vegetable beggar for Wegener. Because if you say vegetable beggar a lot of times fast, it sounds like Wegener. Okay, so Wegener granulomatosis presents with upper respiratory, lower respiratory, and renal problems. So this guy over here has upper respiratory problems, lower respiratory problems, and renal problems. Let's discuss those. So upper respiratory problems include perforation of the nasal septum, and that's why he has this nose ring over here. It helps remember the perforation of the nasal septum. Chronic sinusitis, and that's why he has this sign over here by his nose. Otitis media, that's why he has his ears here exploding, and mastoiditis. Lower respiratory tract problems include hemoptysis, and that's why we see he coughed up some blood over here, as well as cough and dyspnea. He's having trouble breathing, shortness of breath. This nephron over here is going to remind us of the renal problems, including the necrotizing glomerulonephritis. That's why he's on fire. And this leads to hematuria. That's why we find this blood on the floor over here from the urine, as well as red cell casts. The triad, actually, of Wegener syndrome includes focal necrotizing vasculitis, necrotizing granulomas in the lung and upper airway, as we explained, and necrotizing glomerulonephritis. Let's take a look at lab values. So here we see a histologic picture of the neutrophils. We see the granular cytoplasmic staining, and this is caused by the PR3 ANCA, or the C ANCA. ANCA standing for anti-neutrophil cytoplasmic antibodies, and these are autoantibodies against the neutrophil cytoplasm, and this is what shows up. Chest X-ray is going to show large nodular densities and is due to the lung problem. And over here, treatment. Treatment is going to be cyclophosphamide, represented by this cycling phospho up here, on top of the glued quarters to remind us of the glucocorticoids and corticosteroids. Okay, I hope you enjoyed this really weird scene on Wegener syndrome, Wegener granulomatosis. Stay tuned for our next video, and take care.
About pros, the therapeutic strategies accepted for GPA treatment are effective. Gastrointestinal tract involvement is less common, affecting 10% to 24% of patients with GPA, and is usually detected in autopsy. About cons, some complications require surgical intervention. The disease has a predilection to the upper and lower respiratory tract and the kidneys, but most patients also show systemic disease.
EGPA is an ultra-rare lung disease that affects about 5,000 people in the U.S. Its proper name is eosinophilic granulomatosis with polyangiitis, but that's a bit of a tongue twister, which is why we just say EGPA. Adults with allergic asthma are at higher risk for EGPA and may have any combination of the following symptoms, including feeling ill or tired while experiencing fevers, loss of appetite, and weight loss. Other symptoms include chest pain, shortness of breath, rashes on the skin, muscle or joint pain, sinus pain in the face, nasal discharge, abdominal pain, bloody stools, and/or numbness or loss of strength. Since EGPA is so rare, it isn't top of mind for physicians or patients. But it's a severe lung disease that can lead to permanent damage, so it's vital for physicians like me to know what to watch for. There's no single test to diagnose EGPA. Your doctor may order several procedures such as blood tests, a CT scan, and a tissue sample to rule out other diseases and confirm diagnosis. While there's no cure for EGPA, there are treatments to help control your symptoms. But it's also important to treat the underlying asthma. There are other ways that you can help your self-management plan, such as eating and sleeping well, getting regular exercise, and keeping up to date with vaccines like the flu shot. It's also important to avoid tobacco and other irritants that might compromise your lung health. Living with a chronic lung disease can be challenging. The American Lung Association has resources available on diagnostic tests, treatment options, access to support groups, and more. Start your research today at lung.org.
About usual apply in Ecuador, if not properly treated with glucocorticoid medications, the patient may die within a few months, and this treatment hasn't been used in Ecuador.
I'm Jennifer Gordon, and I'm a native Philadelphian. I was diagnosed with EGPA 3.5 years ago. I've never really been sick before. I did have allergies as a kid, and in my 30s and 40s, these started to get worse and became year-round. And then I started to develop asthma as an adult, but otherwise was pretty healthy. And then things started to get strange. I had this whole constellation of symptoms. I had sinus problems, the lung problems, the asthma, the eosinophilia, the neuropathy, the skin problems. So all of these were pointing toward possibly EGPA. Yeah, so when I'm having a flare and my vasculitis is active, it's kind of like slogging through quicksand. Everything is like an assault. Light, heat, wind, whatever, coming at you. And you're just trying to push through everything day after day. One of the biggest impacts on me has been meeting other patients with EGPA and vasculitis. Being able to talk to or communicate with other people that have my disease is really, really important. It's been life-changing for me. Living with EGPA is living with uncertainty every day. I don't know what's going to happen tomorrow, but I'm going to be ready for it.
Finally, the conclusion. Active inflammatory process located in the gastrointestinal tract in the course of GPA is a rare complication. However, it does occur, causing a severe threat to the lives of patients. Therapeutic strategies widely accepted for GPA treatment are effective in treating patients with gastrointestinal involvement in the course of the disease, although some complications require surgical intervention. Thank you.